All right, hello everyone. Welcome to Seminar 8. I'm sorry that I couldn't join you today. I had something come up last minute, so I figured I would go ahead and record this so that you would have this for your reference. As always, we'll start with a little housekeeping. I'll go over the next assignment, and then we're going to go into the topics today, which are related to globalization and some of the challenges, climate change and global health, conflict in healthcare. And then, of course, we will not have open discussions and questions. However, if you do have any at the end, feel free to email me. All right, just a couple things to go over. This is the second to last seminar. There will be no seminar next week due to Labor Day. Please be sure that if you have anything past due to please turn that in please give it to me by the end of the 14th or 15th. I do have to submit grades that Wednesday. So please just be fair to me, be fair to your classmates, try to get everything submitted so I have time to look at them and grade them appropriately. As for Unit 9 assignment, I posted a announcement for the course that hopefully you have read, and I mentioned that there's a bonus, there's an incentive I'm giving you to do a really good job on this final assignment, where if you do score 100% and everything is perfect, I will let you know and I will give you a pass for the final discussion board. All right, so make sure you do a good job on that and you will be rewarded. And before we get started, I would like to highlight one of your guys' submissions that Nick submitted for Unit 7. I just wanted to show this to you because I think that the way Nick did this poster, did this infographic, it was outlined very well. It's eye-catching. The colors are fantastic. I think if I saw this sitting at a public health clinic or this was distributed as a marketing material, I think this would be a very good, engaging piece of information that would get people's attention. There's not too much information on it. It's not too simple. I think there's just a nice balance. And just for the sake of critique, I think if there was only one thing I would change about this, it'd be this last area down here in green, where it says only through an approach that includes school-based home influence and physical activity interventions. Then mention socioeconomic factors. I think for the audience that might just be a little bit over their heads, and I would just try to simplify this and put it more in layman's terms. Other than that, great job, Nicholas. This is really what I was striving for with these assignments, and his write-up was just as good. All right, so let's get right into the topics for this week. We're going to start off with globalization and some of the challenges. Now, if you don't know what globalization is, it's defined as the integration and diffusion of information, culture, and policy, and the interdependence on trade and social relationships that develop at the international level. Now, it is a side effect of the technological boom, trade, and increased intercontinental travel. Although globalization has been a driver for positive change and advancement for some countries, increased integration and interdependence has also introduced new challenges. Among these challenges is travel related to disease transmission and the continual expansion of the income gap between countries, as well as the associated problems that arise from socioeconomic inequity, including human trafficking. To improve global health status, the collective agreement and collaboration between countries and the modification and implementation of policies is required. However, several political and ethical challenges must be realized and addressed. Key global health issues. Increased integration and social movements have led to shifts in the world economy based upon territorial expansion, colonial expansions, and changes to the forms of capital and communication. Collective action and social movements have revolutionized governments and economic structures accompanied by population growth, food price increases, and rebellion. Increased trade has allowed companies to expand globally to seek higher profits through cheap labor and larger customer markets. Now, as globalization continues to transform local economies because of migration and cross-border trade, the gap in global inequalities is widened between these countries. Now, the concept of sustained exploitation, which stems from neocolonialism, it lends itself to this idea that resources are extracted and flow from economically underdeveloped countries over to wealthier countries. Poorer countries are more susceptible to human rights violations and due to financial instability would be unable to protect themselves against exploitation. Now, for example, since obtaining its independence, India has been forced to develop its own new identity, which has been influenced by the subjugation of colonial rule. The U.S. also faced similar challenges after receiving its independence and went through a period where slavery and human trafficking were deemed acceptable. Most new countries take time to adapt and develop over these type of topics. Now, however, whereas the U.S. was able to criminalize slavery and eventually adopt human rights legislation, India may face a greater challenge with trying to do the same, and we know that as globalization. So taking a look at some more key global health issues, particularly social economic status and health disparities, as well as human trafficking and travel-related disease transmission. The transformation of global economies and widening income gap may have a negative impact on developing countries by making it much more difficult to eliminate health disparities. Data has shown that economically disadvantaged populations suffer from greater health disparities and increased risk for disease due to poor environmental conditions, lack of access to medical care, mental health issues, and higher susceptibility to violence. Diseases attributed to health disparities create a cyclical cycle that makes it much more difficult to improve the health status for populations. A lack of access to medical care and healthy environments, for example, poor sanitation and contaminated water, exposes the impoverished to several health risks. Now, the health risks make it much more difficult to obtain work or obtain education. The inability to work or receive that proper education then in turn makes it much more difficult to attain income or improve socioeconomic situation. Therefore, a lower socioeconomic status makes it difficult for people to be able to take part in efforts to help change the environment because of diminished power, resources, and a constant focus on attaining the most basic necessities. This continuous cyclical pattern then becomes multi-generational and is passed down from parent to child. As technology advances and communication becomes easier, the world becomes increasingly integrated and it makes it easier for human trafficking to become one of the fastest growing criminal enterprises. Current estimates of human trafficking ranges between 21 to 27 million victims and is considered one of the largest systematic human rights transgressions today. Women are among the most disproportionately affected by poverty due to more limited economic options, therefore increasing their vulnerability and susceptibility to victimization by trafficking. Globalization has also contributed to the rapid growth within the travel and shipping industries, becoming a catalyst for pandemics. The movement of people and goods is an epidemiologically important consideration for global health because of the potential for disease exposure and transmission, thereby creating difficulties for containment. Unfortunately, fears over the ease of disease transmissibility have been realized with the recent COVID-19 pandemic, which is reported to have originated in China. Now, although the international health regulations obligate countries to report adverse health events that may possibly spread across borders, compliance has remained weak over the fear of trade barriers sanctioned by other countries in an effort to contain an issue, which, as you might guess, would have potentially a negative economic impact. At one point, the international community was debating whether or not China should be held responsible for the irreparable harm caused to the global population by violating the IHR and not properly reporting information on the origin, spread, and lethality of COVID-19. The ongoing pandemic is a perfect example of a global health issue that has been caused by the combination of globalization and the failure to follow policy. Combating key global health challenges will require a reevaluation of current policy as well as the creation of new policies to address the emerging issues that are developing in this dynamic, rapidly changing world. To accomplish a rewrite of global policy, global decision-making entities must come to a consensus as to which global health issues are addressed because different priorities may emerge dependent upon the subjective views of the different parties. Further compounding the challenges to policy development are the polarizing political and ethical views in competition with one another. The achievement of adequate and effective global health policy is through the ethical conundrum created by the divergence of health, safety, and autonomy. One such example emerges when we talk about vaccines, anti-vaccination movements, and the resurgence of vaccine-preventable diseases. By agreeing to and providing informed consent, it is presupposed that individuals are making a conscious, uncoerced decision to undergo a procedure. However, in the case of obligatory vaccines, the consent process is illusory because refusal to vaccinate may result in legal consequences. Now, Poland imposes fines for residents refusing to vaccinate and does not remove vaccination obligation once the fine is paid. Parents in France may actually face criminal charges for refusing to vaccinate their children and can spend up to 6 months in prison for child abuse and neglect, as well as they might be forced to pay several thousand euros in fines. Slovenia has some of the strictest obligatory vaccination laws, with heavy fines for those who refuse to vaccinate, although the strategy is working as demonstrated through the 95% national coverage rate. If the entire premise of informed consent is based upon voluntarism, then obligatory vaccination laws render informed consent invalid, therefore turning it into a legal fiction. Global health, climate, and the environment are inextricably linked. For that reason, climate change is of great concern to the global public health community because of the significant impact that has on safety and security. Increasing global temperatures and extreme weather events are affecting the health, economies, and livelihood of billions, and therefore swift action and policies are needed to slow or completely halt its progression before further irreparable damage is done. The environment has significant influence on the health and well-being of populations, and therefore changes to the climate has a substantial impact on affecting people's access to basic needs, such as access to clean air, safe food and water, and secure shelter. Poorer countries located in tropical or arid climates, like those located in South Asia, are disproportionately affected by global warming, with direct damage costs estimated to range between $2 to $4 billion per year. Additionally, negative health impacts of climate change may potentially force more than 100 million people into poverty within the next 10 years due to heat exposure, an increase in infectious disease transmission, forced displacement because of sustained damage from extreme weather events, and malnutrition. The burning of fossil fuels is one of the main sources of air particulates and pollution and kills more than 7 million people every year from exposure both inside and outside of their homes. Air pollution is responsible for 1/4 of deaths from ischemic heart disease and strokes, more than 40% of deaths from COPD, and about 1/3 of the cases of lung cancer. Among the global urban populations, more than 90% breathe contaminated air that exceeds safe and acceptable levels as set by the WHO guidelines. If the current levels of greenhouse gases and air particulates are not decreased, then increased numbers of respiratory illnesses and deaths are imminent. The indirect consequences of climate change have an impact on health, however, are more difficult to anticipate. Increased temperatures or drought may negatively affect crop yields, thereby causing economic and physical harm to populations who do rely on agriculture for sustenance or income. Climate-related displacement or migration as a result of an arable land or extreme weather can lead to mental illness caused by stress, anxiety, loss of cultural identity, and other challenges with assimilating into a new environment. The distribution of vector-borne diseases is greatly influenced by geography, climate, changes to the built environment, and proximity to humans. So when we talk about health and the environment, these variable climates often result in shifting or adaptation of the vectors or pathogens, which can alter disease incidence and affect the ability of epidemiologists and healthcare professionals to predict or control infectious disease outbreaks. Warmer and wetter climates are likely to affect the seasonality and geographic range of diseases by creating more favorable conditions for breeding and spread of disease-carrying vectors such as the mosquito. Now, food insecurity is the last one we'll talk about here. So one of the greatest resulting health threats due to climate change is food insecurity and malnutrition, and we touched upon this in previous weeks. Extreme weather causes changes in production, availability, and access to food, as well as compromises its safety. Increased temperature creates an ideal breeding ground for pathogens in food sources, and flooding also increases the likelihood for contamination from livestock or nearby sewage. Changes to weather patterns affects and alters crop production and quality, and therefore food prices, distribution, and availability. And then this lack of food creates a shift towards foods that are more calorie rich but nutrient poor, the result of which can cause deficiencies in micronutrients and create obesity. Furthermore, changes to the environment may also cause a decline in the nutritional value of food due to contaminants and decreased nitrogen content in plants. Compromising food quality and access creates changes in maternal nutrition, breastfeeding quality and rate, and leads to malnutrition for infants and children. So, moving on to conflict in healthcare. During times of conflict, attacks against the healthcare system and workers are of great concern, not only because of the unnecessary violence, but its crippling effect on health service delivery and its contribution to the widening of health disparities for vulnerable populations. Women, children, and the elderly have different health needs that must be incorporated into emergency relief planning to mitigate and lessen incurred harm. Fortunately, the World Health Organization and the Office for Coordination of Humanitarian Affairs, or OCHA, are focused on eliminating violence and helping those in need during conflict through awareness raising, advocacy, and policy recommendations. The World Health Organization believes that strengthening of health systems should be included as one of the requirements for compliance with the international health regulations, and that national healthcare system strategies should integrate the IHR and preparedness. The WHO's vision between eliminating violence against the healthcare system is to ensure for the provision of unhindered, life-saving health services to those adversely impacted by conflict and war. The WHO believes that healthcare should be a universal right for everyone and that data supports collective action to help reduce attacks so that services may be delivered according to this right. Now, some of the ways that countries in conflict are being positively impacted by the WHO's work is through equipping and enhancing the ability of hospitals to anticipate, respond, and recover from emergency situations. Toolkits are being provided to guide strategy implementation, as well as global safe hospital initiatives to provide technical guidance, advocacy, and support. As an active member of the Global Protection Cluster and partner to the UN Department of Peacekeeping, the Office for Coordination of Humanitarian Affairs, or OCHA, supports and helps build interagency capacities to promote effective cooperation wherever these peacekeeping efforts are needed. Although OCHA doesn't directly implement protection activities, it helps ensure effective response efforts to meet the needs of affected populations and displaced persons through advocacy, assessment, guidance, clarification of public message, and strategic planning. In collaboration with its humanitarian partners, OCHA helps determine budgets and ensure strategic financing through the Central Emergency Response Fund, as well as country-based pooled funds. They also use their role to raise awareness, provide a voice for those who are affected by conflict, to help connect people with resources for humanitarian assistance, and help advocate for increased funding and support from governments and other parties. Men and women experience conflict and war in different ways, and therefore it is important to recognize these differences and to adjust for the diversity of factors that may lead to greater health disparities between genders. Although international humanitarian law mandates humane treatment of all people, it also includes specific provisions for the protection of women and recognition of different health needs in addition to the likelihood for a higher risk of harm due to sexual violence, trafficking, and culturally based gender roles. Now, in cultures where men are viewed as the predominant breadwinner, and the role of women is to take care of the household and the children, any disruption to the household dynamic creates harmful vulnerabilities. In cases where men go missing and access to basic necessities become compromised, women may have to travel long distances for food, water, or medical care, which then jeopardizes the health and safety not only of themselves, but of the children and elderly family members as well. Now, due to the specific needs and increased vulnerability of expectant and nursing mothers, the IHL requires proper care and treatment in regard to provisions of assistance. Recognition of gender differences has caused organizations to push for training programs to help improve humanitarian responses that teach staff to become more cognizant of the law and better respond to different needs. Media has also been used to raise awareness via culturally and linguistically appropriate language about sexual violence and other women's rights issues to help educate the combatants and non-combatants about these important considerations. War tends to have a disproportionate impact on children and includes a number of different transgressions, such as abduction, maiming, death, sexual violence, and recruitment as a combatant. Following a 1996 report titled Impact of Armed Conflict on Children that identified children as the primary victims of conflict, the UN General Assembly adopted Resolution ARES 5177 to create a new role as the Special Representative for Children in Armed Conflict. Now, the purpose of the Special Representative is to provide an annual report to the UN about the current challenges children are facing to the impact of war in order to bolster support and convey the sense of urgency for lawmakers to take action and engage in diplomatic discussion. Furthermore, the Security Council has provided a framework to respond to violations against children and has adopted resolutions that request the UN to gather and present data, identify parties who commit the violations, and to engage in dialogue to develop a plan of action to hold perpetrators accountable and prevent future transgressions. During conflicts and other emergency situations, the elderly population are among one of the most negatively impacted groups and are often overlooked in relation to policy and practice. The WHO believes that greater awareness of the needs of the elderly are warranted due to their physical, mental, and oral health, functional status and disability, nutrition, economic considerations, family and social relations, and lifestyle habits. Failure to plan for these needs can turn routine impairments that do not normally hinder daily functioning into severe handicaps during an emergency event. For example, an elderly person with decreased mobility from orthopedic problems may be incapable of escaping dangerous situations. The WHO has attempted to build awareness about the needs and contributions of the elderly, such as wisdom and experience, through several publications that may hopefully guide and inform policymakers in the development of effective interventions that may lead to improved health equity and social services for older people during times of conflict and war. The solution to some of the current global health issues are exacerbated by the globalization and expanding wealth gap between countries. Developing countries are subject to exploitation while all countries are becoming increasingly susceptible to outbreaks of infectious diseases because of increased travel and trade. Interventions and protections in the form of policy are needed to address global challenges. However, these can only be implemented if consensus is reached and political and ethical barriers are overcome. The expulsion of greenhouse gases and the harmful pollutants has caused harm to the environment and led to increased temperatures and extreme weather events since the industrial age began. And as a result of that, countless lives have been lost or harmed as the consequences of human action have taken a toll on the ecosystem. Hopefully, increased awareness, decisive action, and effective policies like those outlined in the Paris Agreement will be effective in helping countries adapt to and mitigate the effects of global warming to safeguard the health of future generations. The protection of vulnerable civilians in the healthcare system during times of conflict has been one of the main focuses of global peacekeeping organizations over the past several decades. Recognition of the differences associated with age and gender are just some of the key considerations that organizations have been actively implementing in order to aid relief efforts, advocacy, and policymaking. Much work is yet to be done. However, continued efforts in raising awareness has contributed to progress being made in the right direction.